So what Chinese medicine can offer to these type of patients? In 2003, the World Health Organization has published a report on acupuncture control clinical trials. So the report was divided into several categories. The first category was diseases and symptoms or conditions for which acupuncture therapy have been proved from control trials to be an effective treatment. Okay, so as we can see, there are 63 diseases or conditions, and facial pain was considered to be one of them. However, in the second category, which is the category of therapeutic effect has been shown, but further proof is still needed, Bell's palsy is categorized in this category, which means we have a lot of clinical trials, we have a lot of acupuncture intervention clinical trials. However, the evidence is not strong enough. So as we know, Bell's palsy, for those of us who visit China or Taiwan, it's very common to see in the acupuncture departments Bell's palsy patients. This study is coming from Taiwan, and it measured the trend in use of acupuncture among Taiwanese population. Okay, and as we can see here, the fourth category. This is the distribution of acupuncture users, and the fourth category is diseases of the nervous system and the sense organs. So Bell's palsy is categorized under this category. Okay, it's quite common to see patients seeking for acupuncturists for this disease. It's more or less the same in Beijing, in China. This study was done in 2004, and the aim of this study was to quantify and to compare patients' characteristics in outpatient acupuncture clinics. So two prominent, very busy acupuncture clinics were used as a primary source. And as you can see, Bell's palsy was in the two clinics, 20 to 25% of the patients were Bell's palsy patients. So there are a lot of patients suffering from this disease using Chinese medicine and acupuncture. So in 2015, there was a meta-analysis published about Bell's palsy and the use of acupuncture. This meta-analysis is quite good. They follow the Cochrane collaboration guidelines, which are considered to be the highest when we are performing meta-analysis. And their conclusion was that acupuncture seems to be an effective treatment. However, there is an insufficient evidence to support the efficacy. And the reason for that is the figure over here. As you can see here, the yellow area means there is unclear risk of bias, while the red area means there are high risk of bias. Okay, so when we are conducting evidence-based medicine, EBM research, there are many factors that need to pay attention. And these factors may influence the validity of the RCT. And unfortunately, in this meta-analysis, all the studies came from China, and some of them had some heterogeneity. Okay, this is very known problem in acupuncture clinical trials to have high heterogeneity between the studies. Mainly involve the design of the control group. Blinding techniques in acupuncture studies are quite difficult. We can do a single blind study, however, double blind is more challenged. The study size should be big enough, large enough, and so on. However, laser acupuncture in that matter can solve a lot of problems. Okay, so these studies after 2015, these studies were published. This study came from Korea, and they use manual acupuncture and thread embedding acupuncture. So in Korea, they really like to do these thread embedding techniques, and they showed positive effects using acupuncture for patients who are suffering from complications of Bell's palsy. So their patients were 6 months and above. Okay, and acupuncture showed good beneficial effects. And this study in 2017 was published and showed the beneficial effect of low-level laser therapy, LLLT, added to facial expression exercises in patients with Bell's palsy. So accumulating all of this data and evidence, we performed here in China Medical University Hospital. We performed a double-blind randomized controlled trial. So this publication you can download if you're interested in how to perform a double-blind RCT in acupuncture settings. Okay? And basically our objective was to assess the feasibility, therapeutic efficacy, and safety of laser acupuncture in patients experiencing inadaptive recovery. As I mentioned before, our study was randomized, it was double-blind and placebo-controlled. We had two groups, and what's really nice and actually quite beautiful about laser acupuncture that it helped us to design a very good control group, and we can control the placebo as well. So there are two laser pens. One is working and it's a true laser, and one is not working. However, it looks the same, it sounds the same acoustic and the same visual characteristic. However, neither the patient nor the physician knows which laser device is real. Okay, so we had this type of two groups. One was real laser and one was a sham laser. The patient received 3 sessions per week for a total of 6 weeks, 18 sessions totally. So these were the points that we used. We used 7 points in the affected area in an ipsilateral form, and we use 2 points on the distal limbs bilateral. Okay, we will discuss about the points later. So at the moment, I cannot share with you the results because they are still under evaluation for publication. But what I can share with you is that our study showed clinical differences between the two groups, and it proven safety. No side effects were reported, and basically it's the first investigation of laser acupuncture treating chronic stage of Bell's palsy, so it's a good reference point for laser acupuncture as a monotherapy or adjunctive therapy treating complications of Bell's palsy. And it provides important information for study design criteria, either for basic or clinical study.